Kia ora and welcome to this COVID-19 live panel discussion. My name's Hannah Martin, I'm a health reporter here at Stuff, and this afternoon I'm joined by community and developmental paediatrician Dr Jin Russell, on my far right. Next to me we've got GP and clinical director for Taruki Healthcare, Dr Lily Fraser, and on my right we have GP and clinical director for Alliance Health Plus, Dr Hina Lutui. We received a whole bunch of questions regarding COVID-19 and tamariki, so we will dive right in. My first question is looking at the Omicron outbreak more generally. So we've seen a really high proportion of cases in children and young people, particularly Māori tamariki and Pacific tamaiki. Why do you think this is for cases in children, and what are you sort of seeing in terms of presentation?
I think early on in the outbreak it was really mainly affecting our Pacifica population. So as we know, with Omicron is more infectious than the previous variants. One person gets infected, up to 15 people could possibly get infected. So if you're looking at our Pacific households, we're often more multi-generational, several families sometimes in a household. So if you've got one person infected, well, it's quite likely anybody in that household could get infected. And so I think that's where some of the stats with our young Pacific children have come from. Yeah.
I also think returning to school, so that allowed COVID to quickly spread, within the school, but also take it home to the families. And so we saw, our children kind of get exposed to COVID quite early on through being in school. And I think it was quite a common scenario that, kids were getting the note home, particularly when we were all close contacts, that schools had to close down a lot. So we could see the impact of that with so many schools being locations of interest and closing down at the beginning of this kind of surge. So I think that does kind of speak to that as well. That it was those young ones, but remembering also that our under fives can't be vaccinated, and so they don't have any other protection except their own immune system. And it's interesting, we definitely have seen in some whānau, the littlies didn't get it, even though the adults or children did, so their immune system kind of did that job to protect them, but in the same breath, it was more typical, I think, that once it was in the whare, those that were unvaccinated were more likely to get it. And so, I think that makes up a big proportion of those children.
And unfortunately, this is the pattern that we've seen with the pandemic overseas and here as well in previous waves, that it is an inequitable pandemic, that communities, we've seen this as a pattern across international data as well, that communities which are minority communities or minority ethnic communities, indigenous communities, are often harder hit. And here, I think in Aotearoa, consistently throughout, about 30% of active cases have been children and young people. Because we've been able to boost 70% of our adult population, they're going to be protected to some extent from getting any infection from Omicron, but our children are not able to be boosted, and so they're actually bearing a greater brunt of the pandemic at the moment.
Right, okay. That goes quite nicely into another question. Jim, this might be one for you. Why can't we boost children or anyone under the age of 18, and is that on the cards for us here?
So I think we need to watch this space for children who are older adolescents. I think that's under review. But for children who are younger, what I understand is that children's immune systems are actually built really differently. Children have very strong innate immune systems, and they actually do fight off a lot of coronaviruses very frequently. So they're sort of primed to fight off COVID-19, and we think that is behind why COVID-19 in general for children is relatively less severe than in adults.
And Lily and Hina, you've been GPs on the front line, both in South Auckland during our Omicron outbreak. What have you been seeing with regard to symptoms in children? What sort of presentations, I suppose, are you getting?
So it's your typical cold and flu symptoms that we're seeing. So fevers particularly are really difficult for little children. Nobody likes to be febrile, and that affects things, can make children vomit. There has still been diarrhea with this Omicron surge, and so dehydration is a real concern for those littlies. And then the runny nose and cough are the other things, but just really tired and sleeping a lot. Right through to some people may just have a runny nose for a day and then be running around like nothing's happened. So it's the whole spectrum. But I think, one of the main things that may lead to a child being admitted to hospital is around that dehydration and, not being able to keep the fluids down. And therefore, they don't have so much in their body to when they lose, that little amount, they just need that extra help in hospital.
Sure. Is that something that you would say is common?
Jin might be able to speak a little bit more about what the hospitalisation rates have been for children. I think that we have good medication to be able to support littlies to stay at home, so things like nausea tablets that littlies can take, which means that once the vomiting stops they can actually drink, and then things like electrolyte drinks like Pedialyte, that means that even if they are having diarrhea, they absorb their fluid more effectively. So those measures, if you can get them early, can actually prevent kids ending up in hospital, but they can get sick really quickly for sure.
I was just going to say, just with the patients that we've looked after and covered, very little have actually ended up in hospital. Most of it's actually been managed in the community. And we've looked after babies as young as 6 weeks old with COVID, to be honest, and they've stayed in the community and they have not ended up in hospital. So the severity is different on everybody. We don't know which ones will end up there. But, viruses and looking after children with virus is bread and butter for our general practice. We know how to give advice to our young mums and parents and grandparents. And if it gets to a point that they need the support, then obviously we'll send them in. I always like to remind parents, COVID is like a virus. It's like, RSV, bronchiolitis. Some kids are fine, we look after them in the community, and others we end up sending to the hospital. It's kind of like that, to be honest.
Yes, and I think what we've seen in a lot of paediatric hospitals is a lot of children presenting to ED to get the kind of care that I think actually you can also receive at the GP, but a very small proportion of those children do need to be admitted. And I think as paediatricians we are quite cautious around very little children, particularly very little children have fevers. We'll often admit them just to observe, not necessarily to give any specific treatment. So that also causes a number of hospitalisations for our little ones.
Okay. We actually had a related question from a mum named Cheryl. She has a 5-week-old baby and was wanting to know what COVID-19 typically looks like in a newborn, and are there any medicines or supplies she should have in her home in the event that her wee one gets sick or they have COVID in the house.
Well, I think the symptoms are exactly what Lily sort of described before, to be honest, and it's more about reaching out to the GP and having that close relationship so they can continuously monitor and see if there's any changes, because it's more about the changes that occur that we look out for. At a 5-week-old, there's not a lot we can particularly do, except that, hopefully before people get it in their households, we're still recommending whānau and things to be vaccinated, because that will give the biggest protection. And if you're currently pregnant, to go out and get your COVID vaccine as well, because there is some evidence that possibly that it could still give some protection to the newborn. And so that's probably the best thing we can advise at this stage. Yeah.
Okay. Now, we were talking before about schools, and this is something that we've heard a lot about recently, the high number of cases in a school environment. Generally speaking, how safe are schools for children at the moment? And an addendum to that, is it a good idea to be sending your kid on camp? That's a question that we've had from a parent in the newsroom.
Yeah, which I've spoken about as well to the media. So I think what's important to understand is, Omicron is here to stay, so we do need to kind of look at the long term and what we need to do over the long term, because we might have waves coming and going, but generally there's probably going to be a background level of several thousand cases continually for quite a long time. So as part of that, we do need to think about, what's going to be best for our children long term. Now, we try to make schools as safe as possible so that children are able to access in-person learning. But the thing with COVID is that you get these waves, and as the level of COVID-19 rises in a community around a school, obviously that's going to have an impact on a school. So lots more children will present to that school and they'll be infectious. The number of children who are COVID positive who are linked to a school doesn't tell us where the transmission does occur. Right. Absolutely, there will be some transmission within schools. So for schools, what's really important for our educators is to continue to put those mitigations in place. Things like the ventilation, reaching out to the MOE ventilation team, masking, having all your teachers boosted if you can. So all those sorts of things will help. But yes, the level of COVID-19 within schools will rise and fall, and we need to work really hard to make sure that we keep the level of transmission within schools really low. And studies have shown that where we can put those mitigations in place, we can keep that level of transmission lower than in other settings. Now, it doesn't mean zero, obviously, and that's, I think, why we do need all families, all children who are eligible to be vaccinated so that we can protect everybody, because it is quite unpredictable. And even within this wave, we've had schools who've been able to open completely. There's been very little transmission. They're doing great. Those communities doing great. And there's been other schools which are hit really hard. And so each school is different, and we need to be able to pivot rapidly. So, you know, what I'd say is get your whānau ready, everybody be vaccinated. That gives us a good chance. Schools are doing their best as well.
Okay, and a camp environment?
Oh, look, if we're at the peak, I'd just say, you know, if you're at a peak in your community, going on school camp might just increase the chance of spread, and those sorts of things can wait. And I'd say the same for any kind of indoor activity where you might increase the chance of transmission. But you know, those are the sorts of things where once the wave has moved through, it's safer to go ahead. I think those things can wait a little bit.
I think, you know, so my daughter, you know, we live in Auckland, and so she had 5 months off school last year. And, you know, that has a big impact on people, right? And particularly children. And so I just think that, you know, the general feel of what I hear is that schools are really committed to doing their best to stay open. There are going to be times where they need to close, and ultimately I have heard of a lot of whānau making the decision to homeschool. And right, so you've got to, each whānau's got to do what feels right for them. But I know that returning to school has been so, you know, beneficial for my daughter's well-being, her socialization, and just her general happiness. And you know, we just accept that there are going to be times where it will close temporarily, particularly if the teachers are affected, because, you know, school needs to be a safe, supervised space.
Sure. And just on masking in schools, we've heard from a couple of parents whose children are too young to sort of meet the threshold for masking indoors. They were asking what your recommendation would be, both as doctors and as parents. Do your children wear masks in schools if they are not required to?
My children do wear masks, and they do that really happily. I know it's not required, but you know, there are children within our community who are medically at higher risk. If your child's comfortable to wear a mask, and even if it's not mandatory, I'd say, yeah, that's a really nice thing to be doing. And particularly because it's about timing. We're in a surge. It's a reasonable thing to do. When things change, we might that might be looked at again. But at the moment, now's not a good time to drop masks.
Sure.
My daughter's 10, so she has to wear one. She's also double vaxxed because I just want to have that, you know, as many layers of protection that she can during this surge.
I guess the other thing to remember when things do actually relax a little bit is the same principles apply. If you're sick and unwell, stay home. You got a cough and a sniffle, you know, maybe wear that mask. You know, these are things that we should carry on into the future. You know, there's advice that would give to people before we had the pandemic. It applies now and it'll apply in the future. You know, that's one of the things we know is that, you know, if you're sick and unwell and you go out and stuff, you are going to spread those things around. And it might not be COVID. There are other things in the community that can make us sick and unwell, not just COVID. And that's, I think, another point that I just want to bring up as well while we're at it. Thanks.
Now that actually leads into, so a mother named Olivia had a question about those under 5. So with some mandates and other restrictions about to lift, but most of New Zealand yet to see the peak, how do we best keep preschoolers safe from COVID-19? Would it be best practice to keep them away from kindergartens or from Eces at this stage in the outbreak?
So within the traffic light framework, actually under red, there is a sort of almost a recommendation that when transmission is really high in your community, keeping your children home from daycare, if you can manage that, is not a bad idea. And I'd say if that's what you need to do for your whānau and you're able to do it, that is not a bad idea. But, you know, again, within ECEs, there are lots of things that can be done to make those environments safer. Playing outdoors, if you can, and we've had 100% of our face-to-face teachers boosted. That's really important. If they're able to have been boosted by now, they would have been. So we have achieved very high levels of vaccination in our teaching staff already.
Okay. Anything else to add?
Ultimately, each whānau's got to make their own decision. You know, what are your work commitments? What support do you have to be able to provide alternative support? And I know that, you know, that really varies from whānau to whānau. And I know that when little kids first started going back, I know that some of our staff really struggled with that decision. But, you know, I think you've just got to do the best that you can. And, you know, so many of us have had Omicron now that, you know, I think it's just, as you said, it's becoming part of what we've got to experience living with COVID.
Sure. We've actually we've had a few questions on that who report that their children have recently had COVID between their doses of the vaccine. And we know that there's a stand down period, but a couple of parents seem to have seen some conflicting advice about the stand down period. Some were saying they thought it was once you've recovered from infection, 4 weeks, 12 weeks. Can we just talk about why that exists and how long is recommended?
So the recommendation at the moment is if you've had Omicron, wait until you've recovered, then count 12 weeks. At the 12-week mark, continue with whatever vaccinations you needed. Please complete the course of vaccinations because it'll give you the best long-term immunity. Trying to give the dose of vaccine earlier than that might do something, but what I've been advised is it's the most immunologically useful thing to wait for 12 weeks because that period actually will give you really good long-term immunity, and the chances that you'll catch COVID-19 again in that 12 weeks is not zero but low.
Yeah. So kind of view having COVID as, you know, it's boosting your immunity, and so you're just really trying to make the most of what's available to you as well, and so pushing it out to that kind of, you know, that immunity starts to wane after 3 months. So, you know, getting that next booster and or that next dose in, whatever, you know, for the children it'll be the first or second dose.
Some people think, oh, I've had COVID and now I'm done. That's really not the way to think about it, because this virus is going to come and go, and we might have a few, you know, infections over our lifetime. So what we really want to do is get as much safe immunity in the bank as possible. You know, by getting your child fully vaccinated, we can do that.
That's I'm glad that you raised that, because we were asked that from a number of parents, you know, if their child has been infected, if they should bother getting the second vaccine. So that's great. Now I wanted to ask a related question from a father named Doug. He asked, should he rush to vaccinate his almost 5-year-old daughter now, or should he wait for closer to winter or when we're seeing potentially another Omicron surge? Is there a recommendation as to timing with vaccines given the climate that we're in?
I would still say for him to start at the 5-year-old mark, because we want to have your immune system ready and prepped before the next wave comes. We're predicting when the next wave comes because of the data we've seen overseas, and we've been pretty close, but you want your children fully protected before it hits, and there's 3 weeks in between the first and second dose, and so I would recommend going in early and getting it rather than waiting at this stage, just to give them the best chance of being fully protected before that next wave hits.
Sure. So don't wait for winter or for something to worsen.
No, but having said that, I'd also say winter is coming, the gates are opening, the borders are opening, and so I actually encourage you to make sure your children's immunisations are all up to date, all of them. The timing for having the general immunisations for children are actually different, and that might be where some of the confusion comes as well. So if your child has had COVID, but they're still due to have some of their childhood immunisations because of COVID in the last 2 years have missed out or they're behind or lagging, then they just need to be recovered before they actually can have those vaccinations.
Oh, I see. So that's the likes of MMR, for example?
Yeah, that's right. Yeah, okay. Correct. Because those are due to come back in as the borders open. You know, COVID comes in on a plane, so does measles.
Yeah, that's right. And so in the same vein, you can actually get all your vaccinations at the same time. You can add COVID in to your routine vaccinations.
I see. Okay. Okay, great.
And I think getting that first dose in, right, definitely. And then if you are feeling like you want to wait, you know, like you can go up to 8 weeks for that second dose. So if you want to, that's going to stretch into winter. So you get your first one now, and then you could wait on that second one when you start to see the cases going up a bit. So
yeah, I think something that some people may not be aware of is that the first dose of the Pfizer vaccine for children actually really does stimulate the immune system to a good extent, so they actually get a good level of protection against serious illness needing hospitalisation for that period of time until they get that second dose.
Okay.
Yeah.
And on that, actually, what do we know about the level of protection offered by 2 doses in children against Omicron? We've had a number of parents asking about that, about the booster dose,
Yes.
and the fact that their children are not eligible for it.
Yeah. So what we have to look at here are studies in slightly older adolescents where we have sort of what we call bridging immunological data. So in children who are 12 to 15 years old, 2 doses of Pfizer, whether it's against Delta or Omicron, is over 90% effective in preventing hospitalisation, and that lasts for quite a long period of time. So at the moment, that's the sort of data that our vaccine experts are looking at when they're making decisions about whether we need boosters or not. But because children's immune systems do give a really good response to 2 doses, that's excellent protection.
Yeah. And the research on this is ongoing, right? Because it was only released the end of last year, and so they'll be doing ongoing monitoring to decide if children need a booster and at what point do they need a booster. So I just think we can't predict what that's going to look like.
Okay.
At this
Apologies, I think I might have added to the confusion because some of the early studies for children were done at 3 weeks, but here in New Zealand we actually remember the 8 weeks gap because of that long-term immune response that we want. So it is actually 8 weeks for the children. Apologies.
Sure. But it can be shortened if a child's immune compromised.
Yes, that's right. Yeah,
Okay.
so 3 weeks is the minimum.
Great.
Yeah.
Okay. Okay. Now, what are we seeing? And again, this might be too early in the piece, but what are we seeing with regard to long COVID in children? Is there data on this emerging or otherwise in New Zealand or overseas?
So, I mean, a lot of viruses do cause persisting symptoms in children. Like if we take RSV, for instance, you can get a post-RSV cough that lasts for 6 weeks. It's not uncommon with other viruses to have viral fatigue. Now, COVID-19 is similar for children. Do expect a small proportion of children to have persisting symptoms, and I think it's really important that our health system is ready to receive any children who have persisting symptoms. We heard a lot about long COVID in adults, perhaps less in children. One of the reasons for that is it's not yet completely clear how common it is, but it does look less common than in adults. So for instance, the UK does a population level survey, the ONS surveys. In the most recent survey of children, about 1% of primary school children did have persisting symptoms at 3 months, and about 2% of children who were in secondary school had persisting symptoms. But other data tell us that most of those children will recover by 6 months. A small proportion will need longer term follow-up. I think what we need to be mindful here is if your child has persisting symptoms that are going on for any reason, just see your GP, and we do want people to get care, but it is not quite the same as long COVID in adults.
Okay. This is one probably best for Hina and Lily then. This is from Raywin. Her 15-year-old had COVID a few weeks ago, but is still extremely tired and is coming home from school and going straight to sleep. She still has a cough, sore throat, some sporadic shortness of breath, but not every day. Her question is, could all of these be COVID-related, a sort of incomplete recovery perhaps? And what is the best way to manage these sorts of symptoms?
I was just going to say, yes, it is exactly what Jin's just answered, to be honest. And we definitely have seen that actually with our own patients, where they have this acute phase, as Jin was saying earlier, and then they still get symptoms a little bit later on. And it's possibly because they might feel fine and recovered, but the immune system is actually still keeping things at bay. It's not uncommon. We've had other viral illnesses where you can get them again. So, the mentality, people think that you get it and then it's gone. It's got to change. We used to think that you could only get chickenpox once. Now we do. We used to think you get adenovirus once, but you get it again. So there is examples of other viruses where you can get it again, or where there's been a long progression, post-progression afterwards in the recovery phase. Just like when they're acutely sick, I still recommend if you've still got symptoms, and actually you need to rest. That is your body telling you to slow down, because they might have, because they're excited, they've got out of lockdown, they want to suddenly just rush off and do things, and actually they just probably need to take it a little bit easier for a little bit longer. But yeah, still having that close relationship with the GP. I've had a few young people where the symptoms definitely have lasted 3 to 4 weeks afterwards, and then it's died down, and that's quite a common pattern that I've seen with our youth. Yeah.
Okay. Oh, that's good to know.
And I just think, any children that have got ongoing sore throats, it's really important to come in and see your GP. And I think get a throat swab if it's not settling down, or if you have previously had strep throat to be treated for rheumatic fever, then I think come in and talk to your GP about whether you should also be getting antibiotics for that strep throat. So I think that definitely this is a situation where having an appointment with your GP would be really useful, just to be able to get a full checkup, and you know, sometimes we need to do other things as well.
Okay, great. And just finally, one for the floor. What message would you convey to parents about this sort of phase that we're in with the outbreak? You know, these are scary times for a lot of people, but what would you like parents to know either about COVID-19 as a virus, about the importance of vaccination, ways to take care of yourself? What would your message be?
I think I'd start with this particular variant. We know that it's more infectious, but it doesn't cause as severe disease for most, and particularly if you are vaccinated, and for adults obviously boosted. And yeah, so that would probably be the main thing, and that, you know, and that's the best thing they could do to help protect themselves and their whānau, is to make sure that they are vaccinated and boosted, because really there's not a lot of good treatment for viruses. We'd rather do prevention rather than end up in hospital trying to fix the problem. But that majority of us are actually going to be okay. Majority of us are actually going to be able to manage our symptoms at home with the GP care, and a very small number may need to end up going into hospital or getting that extra support, but the majority of us are going to be okay. And that probably in the future this is going to be one of those common viral illnesses, just like some of the others that we all know about. Next winter or the winter after will be like the differentials will be common cold. Could it be COVID? Possibly. So yeah, I think that's kind of where I'm going with it now. Yeah.
Lily, what do you think?
I just encourage whānau to still get their children vaccinated. I think that, you know, our vaccination levels in children are not up at that high level yet, and I do still see vaccination as a really important tool to get this under control. You know, if we can actually avoid getting the illness in the first place, then we're not going to have these big surges like we have. And so for our tamariki, I would really consider it, right? It's so disruptive to have the time off school and to have to isolate from other people, and I just think that the more we can do to protect our tamariki, the better. And you know, if you haven't had your booster yet, you know, go out and get it, because that's going to make the difference for us over winter for when that next surge comes.
And I just echo that entirely. And the last thing I'd say as a mum and as a paediatrician, you know, the way that we talk about COVID-19 to our children, the attitude that we show towards it, they take their emotional cues from us. So I just want to encourage people, when you're talking about COVID-19, you know, some children may be feeling anxious already because school's really different. It's just, I just try and encourage parents to stay really calm when they're explaining COVID-19 to children, and say to them, you're going to be vaccinated, we are vaccinated, we're boosted, and do that for your whānau. I think that's the most important thing. That immunity is going to go the distance, and so just talking about it in a really calm way towards your children will help them stay really calm as well as we go through these tricky times.
Sure. Oh, well, I would like to say a big thank you very much for taking time out of your busy schedules to be here with us and to answer some reader questions this afternoon. Ngā mihi kia koutou. And thank you to those of you who sent through questions. I apologise if we couldn't get to them all, but please feel free to get back in touch and we will do our best to have these answered. Have a lovely rest of the afternoon. Ka kite.
Kia kite.